I would like to welcome Dr. Yiannis to the podium and take it away.
Great, thanks for the introduction. I want to start off by thanking the Foundation Fighting Blindness for hosting this great event and for giving me the honor of presenting here today. I also want to thank all of you for coming here today. This is an excellent turnout for the first event that we've had here for Vision Quest in London, Ontario. So today I'll be discussing what I think is a pretty interesting topic and pretty timely right after lunch as well, which is eating for healthy eyes. So every day we hear a lot about the importance of eating healthy. And usually it's not just for our eyes. More often we hear about, you should take this or that to prevent cancer, or prevent a heart attack, or prevent a stroke. We hear, take this vitamin, take this mineral, omega-3s, this berry, that berry. No, wait, don't take this or that, though. It's going to interact with this or that. We get a lot of information. We're just bombarded with so much information that it's often hard to process it and know what exactly is good for us and good for our health. Now, if you're scratching your head about what's really good or bad for you, don't be concerned because you're not alone. Even as physicians, we have a tough time putting all this information together because there are a lot of conflicting studies. So in the next half hour or so, my goal is to give you a better understanding of how nutrition plays a role in the normal function of your eye and how that changes with various retinal diseases. Now, although the eyes are pretty small organs, there's a whole lot of metabolic activity going on inside there. And to help you understand what exactly is happening inside your eyes, I'm going to need you guys to use your imagination here, okay? We're going to imagine that our eyes are two little manufacturing plants. And these manufacturing plants produce a picture. So that's the final product that they're going to produce. And this picture is eventually shipped off to your brain. Now, the raw material that's coming into this factory is light. And it goes along an assembly line of very intricate machinery and equipment and gets transformed with each step through that process. Along the way, we need extra materials to help transform that light. But as with any factory, a whole lot of waste is produced as well. So we need some sort of way to get rid of that. Now, there's a few places along this assembly line where nutrients, vitamins, and other molecules are essential. And good nutrition helps keep that factory moving along smoothly. These nutrients also act as the extra material that help transform light. Not only do they help produce the image we see, but they also go in and help neutralize and dispose of the waste that's produced in a safe way. So if you're missing any of the essential nutrients along any of those places, you'd have either trouble producing the picture, or you'd end up with a factory full of waste that's eventually going to stop working. Okay, so now that we have this little factory firmly in our minds, we're going to go into a little bit more detail here. So I want you to use your imagination again here. So just imagine that scattered light is coming off of an image. So to see, light has to come into your eyes. And the first place that light is focused is with your cornea. The cornea is that clear window on the front part of your eye, and it does about 2/3 of the focusing of the light. So that scattered light gets a little bit more focused, okay? And the cornea is overlying the colored part of your eye, which is the iris. Now, in the middle of the iris, there's a little hole called the pupil. So light gets focused by your cornea, goes through the little hole, which is the pupil, and behind there is the lens inside your eye. Now, some of you may have had cataract surgery or know someone who's had cataract surgery in the past. That would be removing the lens inside your eye when it gets cloudy and replacing it with a clear lens to help focus the light again. Now, the lens is responsible for the other 1/3 of the focusing power of your eye. So you've got the light, goes through your cornea, hits the lens, and that focuses at your retina. Now, the retina is where all the action is happening, okay? So we're going to zoom in into this thin layer of the eye. The retina, it's maybe about twice the thickness of a human hair, so it's about 1/4 of a millimeter in size. But as you guys all know, there's a whole lot of action happening in there, and when this place is dysfunctioning, that's when you get a lot of these retinal illnesses or retinal dysfunction. You can think of the retina as kind of being like the film inside the camera, Or for those of you that have digital cameras, it's like the sensor that's inside the camera. So for those of you who have digital cameras, which I'm assuming is just about all of you, how do you measure the power of your digital camera or the sensor? What do you measure it in? Yeah, megapixels, how many pixels you have there. So our retina is actually jam-packed full of megapixels. And those megapixels are the rods and the cones. Now the rods and the cones are what receive the light and start a chain reaction that leads to light being converted from light energy into electricity. And this electrical signal is then transferred to your brain. Now because the rods and cones receive light, they're called photoreceptors. The cones are really jam-packed in the center of your vision, in the area known as your macula. So when someone says, oh, macular degeneration, that's a degeneration of the central part of your vision, the macula. And that helps with your very detailed vision as well as your color vision. The rods, on the other hand, are found more in your peripheral retina. They are found in the center as well, but mostly in the peripheral retina. And they're more important for low light situations. So people that have trouble with rod dysfunction usually have trouble with night blindness or difficulty seeing at night. Now, the whole process of turning light into electricity is something called phototransduction, and this is all happening in your retina. Now, the first important molecule of that phototransduction process is something called retinaldehyde. It's also known as retinal, shorter form of it. And when light hits retinal, that's what causes it to change its shape. And the changing of shape of retinal creates a cascade of electrical activity that eventually gets sent to your brain. So here's where the very first important vitamin comes into play, and that's vitamin A. Easy enough to remember, it's the first one that's important in the chain. Vitamin A is important because it's essential for the production of retinal or retinaldehyde, which, as we mentioned, is the very first molecule in that phototransduction process. So if you lack vitamin A, it can impair your vision, and this usually starts off as a decrease in night vision. It can also cause problems on other parts of your eye, like the very front part of your eye, giving you a very severe dry eye, or even causing the cornea, that clear window on the front, to become cloudy, and in some cases melt if you have very severe vitamin A deficiency. Luckily for most of us in North America, though, getting vitamin A into our system isn't that difficult unless you have a problem absorbing it. And that usually comes from some chronic conditions like pancreatitis or cystic fibrosis, or basically anything that causes problems with your bowels, because your bowels are what absorb the vitamin A. Now, does anyone know what are some sources of vitamin A in our diet? Can anyone think of it? It's one of the harder vitamins maybe to think of where they come from. Any guesses? Shout them out. I don't know your name, so I'm not going to pick on you. Yeah, we heard carrots. Anything else? A little bit less tasty food that's packed full of it? Kale. Yep, you can get in kale. Even less tasty than that. Animal liver. Yeah, that's jam-packed full of it. Now, I don't know if any of you guys do hunting up north. If you do, avoid polar bear liver. Now, I don't know if any of you guys are going to come across it, but it is so packed full of vitamin A that it can give you a toxic dose just from eating a very little bit of it. Okay, so avoid polar bear liver. That's our first lesson for the day. I don't know how practical it is. It may not come in handy for you, but in case you're in that situation. The other things that have a lot of vitamin A are actually paprika, red pepper, cayenne, or chili powder. So delicious things you can put into your food. Sweet potatoes. A few people mentioned carrots as well. And the dark leafy greens, so your kale, your broccoli, things that you may not like to eat too much. Basically, the more intense the color of a fruit or vegetable, the more vitamin A it likely has. Now, in order for this phototransduction, remember, light turning into electricity to occur, it requires a membrane for the reaction to happen across. And that membrane has to have a certain fluidity to it to allow electricity to run along it. Now, fluidity is given to a membrane by one of the major omega-3 long-chain polyunsaturated fatty acids. And this has got a very nice long name, docosahexaenoic acid. or DHA, 3 letters. There you go. We shortened it from 20 down to 3 letters. So DHA is an important component. DHA happens to be a major structural component of the retina. So that helps keep that membrane fluid and allow electricity to run along it. Another important omega-3, and you know it's important because it also has a very long name, eicosapentaenoic acid. No, I won't spell it out for you, but it's EPA for short, okay? So we have DHA and EPA. We've shortened it down to 3 letters for each one. Those are important omega-3 fatty acids. EPA plays more of a role in the signaling molecules that help send the signal across your retina. So does anyone know where we can get omega-3s from in our diet? Fish. There you go. Perfect. So fish, other seafoods, the oils of fish are highly concentrated with omega-3s, and specifically the good ones you want for your eyes. That's the DHA and EPA. It's actually not the fish itself that produces the omega-3s. It's actually marine algae that produce it, and they become enriched and concentrated in the fish oil because that's what the fish are feeding on. Now, some of you may have heard that you can get omegas from other food products like vegetable oils, walnuts, flax seeds, soy, but this gives you a different type of omega-3 called ALA, alpha-linolenic acid. So we've shortened everything down to 3 letters so you can keep it in your mind, okay? It's the DHA, the EPA, and the ALA. The ALA, we can say, is maybe slightly less important for your eye health. It's converted into DHA and EPA within the body, but only in small amounts. So if you're getting all your omegas from, say, walnuts or vegetable oils, you probably wouldn't be doing a good job of getting enough DHA or EPA. Now, DHA, which we said is an important component of the retina, is a type of fat, and it's very oxidizable. So what does oxidizable mean? It means that oxygen can react with it, and when that happens, it can produce something called free radicals. Now, the retina has a very high level of oxygen, and it's made up of a structure that's very highly oxidizable. So we've set ourselves up for trouble here because we have this very strong oxidative reaction going on in our retina, and it's producing lots and lots of free radicals. Now, you may have heard of free radicals before when hearing about nutrition. Basically, what they are is they're very unstable molecules, and what they do is they can damage nearby cells. So we went back to our factory analogy. If you have a lot of byproducts, a lot of waste sitting around, it's going to damage the machinery. Things won't be made as well. Okay, so free radicals, that's the main waste product that we kind of want to neutralize. And how do we neutralize them? Well, that's with antioxidants. Now, an easy way to remember antioxidants is with ACE. So again, another 3-letter acronym we have here. Vitamins A, C, and E. Those are really good antioxidants. As well, there's certain pigments with a little bit longer names. One is zeaxanthin, and the other one is lutein. Now, these are pigments, and they can be found in the center of your vision, in the macula. And it's important there because that's where this phototransduction reaction is really happening in full force. So we said vitamins A, C, and E. We know where we get our vitamin A from. How about vitamin C? What are good sources of vitamin C that you guys maybe got some in at lunch? Yeah, oranges or citrus fruits. Good. So a whole lot of fruits. Luckily, vitamin C comes from mostly delicious things, which is good. So guava, papaya, kiwi, all these exotic fruits have high levels of vitamin C. You can actually get it in some of your vegetables as well. So red and yellow peppers actually have a higher concentration of vitamin C than orange does. So you can get a fair bit there, as well as broccoli and Brussels sprouts, if you like those. How about vitamin E? Anyone know where we can get that from in our diets? This one's a bit tougher to know, maybe. Yeah, nuts. That's right. So nuts are a good source. Seeds, vegetable oils. You can also find it in small amounts in those green leafy vegetables. So those kind of have all the vitamins in them. And you also find it in fortified cereals as well. So people have been adding a lot of that stuff into cereals that we eat. Okay, so we have that information in our mind now. Let's go back to that light pathway, okay? So now we're all experts on this phototransduction process. It's firmly in your mind here. So Light gets focused by your cornea, then your lens, and bam, to the back of the eye to your retina. Light hits the retina, changing the shape of retinal, which we said requires vitamin A to be made. And that starts off the phototransduction process, which occurs across a membrane. And we said the membrane requires DHA, which is our omega-3. The electrical signal moves along the retinal layers with the help of signaling molecules made of EPA. And then you have all this extra junk that's kind of produced, the free radicals. And that's where vitamins A, C, and E, as well as lutein and zeaxanthin, come into play and mop up the mess. So once that electrical signal is made from light, it gets passed along to ganglion cells, to the little optic nerve at the back of your eye, and then off to your brain. And that's what helps you see. So that's kind of it in a nutshell. So now that you all know how light's converted to electrical signals, and we know the roles of vitamins A through E, the omega-3s, let's talk about how this applies to different retinal diseases. Now, the first one I want to go into is age-related macular degeneration. You may have heard Dr. Shado talking about this at length earlier today. We heard a fair bit about it. We know that in the developed world, AMD is the leading cause of blindness in those over the age of 55, and it accounts for about 50% of the non-reversible blindness in North America. There's the two major types of AMD, the neovascular, or the wet type, and the atrophic, or the dry type. And as Dr. Shado mentioned this morning, in the last couple of years, we've developed excellent treatments for the wet type, which is those anti-VEGF agents that you get injected into your eye. But we currently don't have very good treatment for the dry type of AMD. There have been a few good high-quality studies, though, in the past that suggest that certain combinations of vitamins and minerals, however, can be beneficial for slowing down the progression of dry macular degeneration, of the mild or moderate form, to a more severe type of form. And the big studies that you may have heard a little bit about earlier are the AREDS studies. AREDS stands for the Age-Related Eye Disease Study. And the first one was published in 2001. This was a very large-scale study with over 3,600 patients included. So they had a lot of patients with AMD in this study. And the average follow-up of these patients was over 6 years. All the patients in that group were over the age of 55. And they were randomly assigned to be in one of 4 different categories. The first category of oral supplementation was one that was high in antioxidants. So they got a lot of vitamin C, vitamin E, and beta-carotene, which is a precursor to vitamin A. The second group got a high dose of zinc, as well as some copper with that. The third group got, the first 2 groups, they got lots of antioxidants, as well as the zinc. And then the fourth group got a placebo, which is basically no medication, to compare it to the other groups. Now, that study showed that there was a decreased rate in how quickly someone with mild or moderate macular degeneration progressed to advanced AMD in the zinc group and in the zinc plus antioxidant group. They found that the patients in those groups reduced their risk of progressing to an advanced form of macular degeneration by about 25%. Now, it should be noted that this reduced risk really only applies to individuals that have mild to moderate macular degeneration. So some of you may be asking yourselves, how do I know if I have mild or moderate macular degeneration? And the only way you'd really know is if you had a retinal examination, so your eye was dilated, and either your optometrist or ophthalmologist took a look inside your eyes. And from that, from the clinical examination, they could tell you, based on certain signs, what degree of macular degeneration you have. So if you have no evidence of macular degeneration at all, these vitamins may not help too much in slowing down any progression, but that being said, it doesn't mean that they're not good for your overall health. Now, at the time that the first AREDS study was released, they actually wanted to include 2 other antioxidants in there that we called carotenoids, and that was the lutein and zeaxanthin. But at the time of this study, so the patients were collected in the mid-90s, there wasn't a good commercially available supplement that had lutein and zeaxanthin in it. So it wasn't included in the first study. And Beta-carotene, which was in the first study, has been found to increase the rate of lung cancer in patients that are smokers. And we know that smoking increases your rate of macular degeneration. So a lot of people want to know, can we take beta-carotene out and substitute it for two other carotenoids, the lutein and zeaxanthin? So to answer these questions, the AREDS 2 trial came out. Now, before we go into the AREDS 2 trial, you might be asking yourselves another question, which is, how am I going to get all of these vitamins into my system? So I didn't mention the doses, but the dose of vitamin C that you would be required to get in the original AREDS formula is 500 milligrams. Now, that's actually 5 times higher than what the general population gets through their regular diet. That would be the equivalent of having about 2.5 red sweet peppers, about 7 oranges, 5 cups of broccoli, or 5 cups of strawberries. So just for your vitamin C alone, that's what you need to eat if you weren't taking any supplements. Now, the vitamin E dose, so that was 400 international units. That's the equivalent of 300 milligrams of the alpha-tocopherol, which is one type of vitamin E. That's about 14 times what the actual daily recommended dose is by Health Canada. To get that in, you need the equivalent of 15 tablespoons of wheat germ oil, which I'm not sure if any of you guys have wheat germ oil handy, but you need 15 tablespoons of that, or about 2.5 kilograms of hazelnuts, or even better, 70 cups of boiled spinach. So that's for your vitamin E intake. Now, the zinc content, the zinc was 80 milligrams, and that's about 5 times the usual daily recommended dose. Now, to get that in, you can actually find zinc in a few delicious foods, in beef, in lamb, in oysters, also in certain seeds, pumpkin seeds and sesame seeds. You only need about 100 grams of oysters to get all that zinc in. So that's not too much. But if you're not a big oyster fan, you could eat 2 pounds of beef or 2 pounds of lamb. Or, again, if you really like your spinach, that's 10 kilograms of spinach to get all that zinc into your system. So in reality, there really is no way to get all of these vitamins and minerals into your system with diet alone. It's definitely great to eat healthy and try to get these foods in, but diet alone may not cut it. You may need a bit of a supplement to get all these vitamins in so you don't have to be eating all day. Now, as I alluded to, there were some questions that had still been up in the air after the first AREDS trial, and that's what led to AREDS 2, which started in 2006. And the main questions were the lutein and zeaxanthin. Can those do anything for us? And also there was this big craze about omega-3s. We'd see it everywhere. And they wanted to know, okay, can omega-3s play a role in our eye health? So in that study, again, there was 4 study groups. And what they looked at was, in the first group, patients just received the original AREDS formula. In the second group, they received AREDS plus the lutein and zeaxanthin. In the third group, they got the AREDS formula and omega-3s. And in the fourth group, they got everything. They got the AREDS, omega-3s, and then the lutein and zeaxanthin. They also did a second analysis to look at, okay, is there any effect if we take the beta-carotene out, and if we decrease the dose of zinc from 80 milligrams, which we mentioned is a pretty high dose, down to 25 milligrams. And this was also another very large, well-done study. Over 4,300 patients were in this study, and they were followed for about 5 years. On average, that was the mean. Now, that study found that omega-3 fatty acids actually really had no effect on the formulation, and that lutein and zeaxanthin together appear to be a safe and effective alternative to beta-carotene. So you could take the beta-carotene out and put lutein and zeaxanthin in. And this is good news for smokers, because the beta-carotene, as we mentioned, has been shown to increase your rate of lung cancer, while as lutein and zeaxanthin, that connection has not been found in the literature yet. They also found that a lower dose of zinc, the 25 milligrams, didn't increase the rate of progression to advanced macular degeneration. So from these 2 studies, we can conclude that the AREDS formula that contains vitamins A, C, and E, as well as the lutein and zeaxanthin instead of beta-carotene, is safe and effective to limit or to lower the risk of progressing from mild to moderate macular degeneration to the more advanced forms. So that's all I'm going to talk about for nutrition and AMD. I mentioned a lot about it because there are some good studies. Now, you're probably wondering, are there any other retinal conditions that can be affected by your nutrition? And the short answer to that is maybe. We really don't have a lot of good quality studies for a lot of other retinal conditions. There are two that I do want to highlight, though, because there are a little bit of discrepancies there. The first one I want to mention is Stargardt's macular degeneration. This is a condition that causes decreased central vision and is usually found in a younger population than the age-related macular degeneration. And the reason I want to mention this condition is because I talked about the importance of vitamin A in forming retinal and that whole phototransduction process. But in Stargardt, you actually want to avoid vitamin A supplementation. That's because it can lead to a toxic buildup of lipofuscin pigments and actually be worse for retinal function. So that's not a condition where you want to take large doses of vitamin A. The second condition I want to mention is retinitis pigmentosa, or RP, which you may know a bit about. It's a hereditary degeneration of the retina, and there's been over 100 different genes implicated in this process, so it can also vary in how it looks in different people's eyes. There are a few small studies that suggest that vitamin A, as well as omega-3s, may actually slow down the vision loss in this condition. However, the studies that showed the most promise slowed down the rate of progression by less than 2% a year, and there haven't been any really good high-quality studies like the AREDS ones for retinitis pigmentosa. So you need to take these claims with a grain of salt. So I think I've been talking for a little while now. I've thrown a whole lot of information at you. A few take-home messages to get from this talk. The first is that a diet that's rich in antioxidants and omega-3 will likely promote good eye health and general health. So that includes eating brightly colored fruits and veggies, leafy greens, nuts, grain, and fish. And to get all the vitamins you need in to prevent the progression of AMD, you'll likely need some sort of supplementation rather than just diet alone. But it's a good idea to speak to your family physician or your ophthalmologist before starting any supplements, just because some of the supplements can have an interaction with other medications you take or can have adverse reactions depending on what underlying medical conditions you have. So with that, I think I'm going to stop the part of me talking, and we may open it up for everyone else to ask their questions.
Hi, what would you recommend for a person with Stargardt's who's a vegetarian? What should I be eating?
Well, the big thing is you do want to avoid kind of taking excessive doses of vitamin A. But in reality, when they look at any studies and talk about hypervitaminosis or getting adverse reactions to vitamins, for the most part, it's only when you actually supplement with something, because it's very, very difficult to get these mega doses. So you're a vegetarian, you won't be eating any polar bear liver or the liver of any other animals. You're probably not going to have to worry about getting too much vitamin A into your system. And also, some of the types of vitamin A that you'd be getting, such as beta-carotene, which you get from carrots and other fruits and vegetables, are actually a little bit safer because your body changes beta-carotene. It can be transformed into vitamin A. And when the levels are too high, there's kind of a negative feedback that shuts off the production of it. So if you're eating too many carrots, you may go orange. That's a sign that you've had too much. But you might just want to, I would avoid taking any supplements that have vitamin A.
But by the sounds of it, it sounds like I won't be getting enough omega-3s because I don't eat fish or fish oil.
Yep, so the good news is that everyone's kind of caught on to this craze of omega-3s and DHA and EPA, and because of that, they're now fortifying things like orange juice. You may have gone to the supermarket and saw orange juice with DHA and EPA. And there's no fish, well, I hope there's no fish in that orange juice, but what they actually do is they just supplement it right in there. So luckily, a lot of this kind of food manufacturing business, they've been able to put essential nutrients into places where you wouldn't be getting it to begin with.
Okay, thank you very much.
No problem.
Related to that other question, I didn't catch what a buildup of the vitamin A would cause with the Stargardt's. What you said it would be a buildup of, and I didn't
Yeah,
catch
it's something
that
called
one.
lipofuscin. Lipofuscin's like, it's a pigment that you can find in the macula, so in the central part of the vision. And when you get too much lipofuscin buildup, that's toxic for your retina. So in Stargardts, you want to avoid getting in the excessive amounts of vitamin A. That being said, I wouldn't tell you stop eating your fruits and vegetables because you'd end up having a lot of other problems with your general health by doing that. So kind of the key is kind of taking everything in moderation and in balance. And the best way to do that is with whole foods, because whole foods give you a good combination of different vitamins, minerals, nutrients, as well as fiber, as opposed to just taking supplements. If you're living just off supplements, you can get your vitamin levels out of whack very easily.
As a dietitian, I agree with you 150%. Just one other quick question. You said in the AREDS 2 trial, you had the 4 different groups. Was there a placebo group or not with that?
No, so
AREDS 2?
in most studies, what happens is you can only do a placebo group being no treatment, when there's actually no known treatment for something. So we knew from AREDS 1 that the AREDS formula does slow down the progression of macular degeneration. So from a study perspective, it's unethical to create a completely placebo group not getting anything. So in this case, you can call it a placebo group, or it's probably better to call it a control group, is a group that just received the AREDS formula. So basically, you're comparing the normal standard of care to the standard of care plus all of these other things. So that would be the control or the placebo group, if you'd like to call it that.
There's so much hype over the kind of raw vegetables and fruit and where they're grown and what pesticides are in it and buying organic, which is a lot more expensive. Has there been any study that really there is an effect? Or some of the supplements that have ingredients like soy that maybe somebody's sensitive to, or lactose. How does one figure all this out?
Yeah, so it's definitely, as I mentioned at the start, it's very difficult to know what exactly is good for your overall health. And the North American diet actually really lacks a lot of fruits and vegetables. So even if you said, you know what, the organic ones are too expensive for me to buy or are difficult to find, or say spoil too quickly, I think getting any fruits and vegetables into your system is a good idea, because our diet usually is not composed of a high quantity of fruits and vegetables. That being said, the less time there is between taking a fruit or vegetable out of the ground, off the tree, and ending up on your plate, the better it is. We know that vitamin C, which is one of our important antioxidants, can break down very rapidly when it's either exposed to high temperatures or is frozen. So you have to watch out about how you store these things and how long. And also the whole processing business is also a problem, because vitamin E, for instance, which we mentioned is very important, you find that in a lot of wheats. And you think that with all the carbohydrates we take in and all the breads, you're probably getting enough. But the whole processing business takes out about 90% of the vitamin E that you'd actually find these natural products. So the closer you can get something to it being in the ground still and eating it, probably the better off you are. But there aren't really any good high-quality studies that tell us that. So it's mostly anecdotal evidence and evidence that we kind of find from other studies that say, you know what, this breaks down, so most likely it's better to eat it earlier.
Hi there. I had a question that I was wanting to ask about cooking your vegetables. And I've heard it said that to maintain the vitamins, you have to almost eat the stuff raw. And if you try and cook it, say, in water, you're losing the vitamins. And worse still, a microwave oven, the intensity of the heat breaks down all your vitamins so that before you even put it into you, they're gone. Is that true? Or?
So part of that is true for sure. A lot of the nutrients that you find, especially in the colored vegetables, are in the outside, so in the skin of the fruits and vegetables. So if you're peeling them before you're cooking them, you may lose a lot of nutrients that way. But the temperature thing also plays a role. So vitamin C, again, is one that we know that if you go over about 70 degrees Celsius, it starts to denature, which means that it's breaking down the vitamin C. So if you are boiling your fruits, your vegetables, you're getting it up to over 100 degrees Celsius to boil something. So you may be losing some of the nutrients there. So eating it raw may actually be a bit better for you. That being said, I think any way you get the fruits and vegetables in is probably better for you than not getting it in. But cooking it at very high temperatures may lose some of those nutrients. So raw, yeah, so as you mentioned, raw may be a bit better. That being said, not all food is palatable raw. You do need to cook some of them to get that bit. So your 70 cups of boiled spinach that you're going to get for your vitamin E, you may want to cook a bit first.
My son has Liebers, and does all of this apply to Liebers as well?
I don't know the specifics if there's, I haven't found any good articles when I was doing my research on this for Liebers or other congenital retinal issues. That being said, I think this combination of antioxidants as well as the vitamins and minerals is generally good for your eye health. So it works in the normal phototransduction pathway. So it may not help slow things down or make the process any better. That being said, it's good for the normal function of the eye anyway.
Okay.
Yes, I have advanced RP, and I want to know what degree of, how many units of vitamin A is good for RP, and what is too much.
Yeah, so usually the recommended daily allowance for vitamin A, they say you shouldn't go over 10,000 international units. That's kind of listed as the upper limit of normal that you should go to. Some of the studies that found a slow or a halting or a slowing down of the progression of RP actually used vitamin A doses that were higher than that. I think it was about 15,000 international units a day. So because of that, because the doses are higher than the recommended daily allowances, I wouldn't tell you go home and start taking vitamin A. I would check with your family doctor first just to see if you have any conditions that may give you trouble, because it can cause problems with bone growth, with liver dysfunction as well, hair loss. There's a number of toxicity factors you may find from vitamin A, and the purported slowdown in the rate of progression of RP, it may not be worth it for you, or it may not outweigh the risks of taking such a dose of vitamin A. So you kind of have to balance everything. I know we're really focusing on the eyes here today, but you do have to look at your overall general health as well, just to make sure you're not doing any harm to yourself by helping out your eyes.
I'm interested in, say, cod liver oil, because if you take fish and you cook your fish, there's not much left in it, but would just simply taking cod liver oil be better than trying to get it in any other form?
Yeah, so the fish oils are absolutely packed full of omega-3s. So it's a great way to get your EPA and DHA, and fish oils are great. And they also, I didn't mention about omega-6s versus omega-3s. They really only have omega-3, which is good. You want to really have a high ratio of omega-3 to omega-6, whereas in our diets where there's a lot of processed foods, we get a lot of extra omega-6 into our diet, which is actually bad for your general health. So bumping up your omega-3 levels is good for your general health as well. So fish oils, as you mentioned, is actually a great source of it. If you can palate the fish oil, the cod oil, then by all means, it's a good source of omega-3s.
If age-related macular degeneration or other age-related diseases like that run in the family, at what age should you really be concentrating on taking ARED vitamins and supplements?
So if we look at the results of the AREDS study, as I mentioned, the population was anyone over the age of 55, and the groups that had that decreased rate of progression, so the 25% reduction, those are people that had either mild or moderate macular degeneration. So if you're a younger person and have no evidence of macular degeneration, I really can't be saying to you must take the AREDS formula. You may want to be taking a multivitamin on a daily basis just for your general health, but you wouldn't necessarily need to be taking an AREDS formula. If, however, you went to your ophthalmologist or optometrist and they said, oh, I'm seeing signs of macular degeneration in your eyes, or if you have advanced macular degeneration in one eye but not advanced in the other eye, that's when you want to start thinking about taking these vitamins to slow down the progression. But in people that have perfectly healthy eyes and no signs of macular degeneration, we don't really know if it does a whole lot for you, just because the rate of progression to advanced macular degeneration is so low anyway in those populations.
Out of curiosity then, along the same topic, there's now supplements that are available off the shelf with lutein and such. Do you suggest that is a good idea as a supplement, or only if we're getting certain ages or with certain diseases?
Well, we know for the macular degeneration that the lutein and zeaxanthin are good. So if you are looking for an extra source of carotenoids, of antioxidants, lutein and zeaxanthin have been found to be safe and effective. So if you don't go over the daily recommended doses, in the AREDS studies, it was about 10 milligrams of one and 2 milligrams of the other. It's probably safe and effective. But that being said, if you don't have any underlying eye condition, you can kind of go either way. You don't necessarily need to take it, but it is a good antioxidant. So it won't just have its effect in your eye, it'll have an effect on your overall general health. And we know that oxidative stress can affect other systems in your bodies.
I'm a little confused about the difference in the two AREDS, one for the smokers and one for the non-smokers.
Yep, good. So I didn't make that clear. So the one, the original one, the AREDS 1 formula had beta-carotene in it. And beta-carotene is bad for people that are smokers because it's found to be linked to lung cancer. So the one that anyone that's a smoker and has AMD should be taking should have no beta-carotene in it and instead have lutein and zeaxanthin in it.
But for the normal person who does not smoke, then the one with the beta-carotene is okay.
For the non-smoker, either one of them would be fine because the AREDS 2 trial found that they were equivalent to each other.
We're taking 20 milligrams of lutein, and I'm wondering if you think that's too high, too much.
Well, it's hard to know what exactly is too much for each individual person. That falls well within the normal range. The AREDS studies were about 10 milligrams that they had in there. So that's usually the recommendation that we have for it. 20 may be a bit on the high side. That being said, as with any of the multivitamins, I would just check with your family doctor to make sure that it's okay for you. Just because it's a little bit different for everyone depending on your kind of overall general health.
Thank you all so very much for all of your questions. And again, thank you, Dr. Iordanous.
No problem. You're welcome. Thank you.